It was at birth. We kind of knew that this was going to be the route right off the bat. It was just about managing what function she had.
Well, dialysis is basically kind of one of the diagnoses you never want your kids to have, because it means that your kidneys aren't working. And when you have to go on dialysis, the machine is basically your kidneys.
It's scary when they have to put something in the tube and clean it out and stuff. It's a little scary at first.
When we got to dialysis and we were able to use this facility instead of having to go up to Kansas City or wherever the nearest dialysis center would have been.
Once you get used to it, it's nothing. It doesn't hurt at all. They're really noisy when they beep. It's obnoxious.
We try to make it as enjoyable as we can. The nurses really get to know the kids and their families, and they really bond with them, try to find the things that the kids like to do in their chairs.
They used to kind of light up my day and stuff. I did arts and crafts. I played on tablets. I decorated a lot of things.
These particular kids are all outpatient, and they have a chronic disease in their kidneys. So they basically go into end-stage renal disease is what we do, and it's ESRD is what you'll hear them say. And these kids have to spend 3 days a week in a chair for 4 hours and basically be entertained. They can't move off the chair. They can sleep, they can watch TV, but they basically have to sit in a chair and just have the machine work for them.
Yeah, it's for at least 4 hours. But plus 15 minutes or so to unhook and stuff.
We've had, 3-month-old on dialysis. We've had premature babies on dialysis. If their kidneys stop working, you have to find a way to get the toxins out of their bodies.
She talks about all her dialysis nurses all the time, and the friendships that she made with them, the relationships they built.
Well, the most rewarding is when we can see kids like Lindsay go to transplant. We work really hard to keep them and get these kids to do what they have to do, because it really is hard for them to maintain a normal life on dialysis by eating. If you think about what your kids like to eat and candies and chips and salts and that kind of stuff, it's really difficult. And not to have those things in your house, if you have other siblings, if you have other people that come to your house, you always have to watch what your kids eat and drink. And I think the best part for us is when we find out that these kids get a kidney and they can live a somewhat normal life and they don't have to come in here anymore. We miss them, but it's so great to see them come in and see that they've grown and they are happy and they have a smile on their face and they're not grumpy that they have to go sit in a chair for 4 hours. So really the most rewarding part is when they get to be transplanted.
You'd think it was tough, but the care that she got while she was here at Wesley was amazing, and unbelievable, as Lindsay would say.